Hello everyone, welcome back to another video. This is your favorite therapist, Novia McLaren, licensed marriage and family therapist in the state of Connecticut. So today I'm excited to bring this video as I have been noticing a rise in clients presenting with struggles with ADHD symptoms, attention deficit hyperactivity disorder. Um, Usually it affects mostly children in the past years, but in the last, say, 5 years or since the COVID pandemic, there's been a rise among everyone, no matter your age or gender. So I wanted to go into a little bit about the statistics and then going into some of the clinical interventions that will be helpful, or even self-help interventions that will be helpful for anyone who is struggling with ADHD symptoms. So for starters, there's been an increase in the diagnosis with the various age group, like I mentioned, particularly among children, but adults also. Studies indicate that the prevalence of ADHD among children and adolescents has been rising, with estimates about 10% to 12% of school-age children. And mostly boys are diagnosed more frequently than girls. Girls may be underdiagnosed because there's differences in their symptom presentation. The impact of COVID-19 has been affecting the mental health significantly, leading to increased awareness in this diagnosis. So about 4% to 5% of adults may also have ADHD as a result, though a lot remain undiagnosed. So diagnosis rates can vary significantly depending on the region, healthcare access. So if you feel like you're struggling or you're undiagnosed with this diagnosis, definitely see a mental health provider and formally get the screening to see if you may struggle with some of these symptoms. So I'm going to be going into the symptoms right now. So here are some of the symptoms of ADHD. The symptoms that I'm going to be listing is some of the symptoms, the main ones that most people usually struggle with, but it's important to know that getting properly screened is the best way, because sometimes ADHD symptoms can mimic other disorders that might be overlooked, such as anxiety, or somebody's on the spectrum, for example. So the main ones are inattentiveness and hyperactivity, and impulsivity. So attention deficit hyperactivity disorder is what I'll be discussing. So there's a difference between ADD, which is attention deficit disorder, and then there is the hyperactive component. Some people struggle with only the inattentive symptoms, and some have both combined, which is the fidgety and moving around a lot, which most children tend to struggle with as well, in addition to the lack of focus and concentration. So having a short attention span, being easily distracted, making careless mistakes, have forgetfulness, losing things often, being unable to stick with tasks, being easily distracted, easily bored, being unable to carry out instructions and following instructions, constantly changing activity. So even for an adult who decides to clean their house, they're probably starting with the kitchen, and then they're like, oh, let me go in the bathroom, or oh, let me go in the bedroom. And there's no executive functioning or organization in how they're executing their tasks. They're just kind of all over the place, or if they get distracted, they'll forget what they were doing. So having difficulties in organizing tasks and staying on task and being structured is definitely a struggle for someone who has ADHD. And then the hyperactivity part of it, being unable to sit still, constantly fidgeting, being unable to concentrate on tasks, excessive physical movements, excessive talking, being unable to wait your turn, acting without thinking, the impulsivity aspect of it, interrupting conversations, as having little to no sense of your surroundings. It could be the hyperactive component. So those are just some of the symptoms. So now we're going to get into some of the interventions, techniques that mental health providers typically use or should be using to address someone struggling with these concerns. And these are also some self-help tips for anyone who wants to just start applying some of these techniques on their own. So the first one is psychoeducation. So learning about this disorder or this mental health disorder, educating yourself as a therapist, educating your clients and their families about ADHD. For working with a child, will educate the parents about it as well, and the child if they are able to understand, depending on their age and development. Um, so discussing the symptoms and the effects of ADHD and managing the symptoms, understanding the disorder can help reduce the stigma and promote effective coping strategies. Cognitive behavioral therapy. This therapy helps clients to identify and change negative thought patterns and behaviors. Um, it can be particularly effective in managing symptoms of ADHD, such as the impulsivity and the emotional regulation aspects. The third one is behavioral interventions, implementing strategies like reinforcement systems. This works particularly well with young children. And it encourages positive behaviors. This may include like reward systems for completing tasks or following routines. It's very important for someone with ADHD. Structure is the best intervention and consistency. The fourth one is mindful relaxation and breathing techniques. Teaching mindfulness practices to help clients improve their focus and self-regulation. Techniques such as deep breathing, meditation, and yoga can reduce anxiety and improve attention. Executive functioning skills training, which is working on the organization and the time management and planning to help clients manage daily tasks and responsibilities more effectively. The next one is social skills training, helping clients develop interpersonal skills through role playing and social scenarios, which can enhance their ability to interact with peers and adults more effectively. 7 is medication management. This is definitely based on the case-by-case basis, and it's optional. Not a lot of clients are prone to taking medication, and in which the other techniques that I discussed would need to be really consistent and ingrained for the person to really try to overcome their symptoms without medication. But medication management is definitely a good choice for some as well, and it does help. So collaborating with a psychiatrist to determine if medicine is appropriate for you. Stimulant or non-stimulant options are available, and then they both can help with the symptoms many individuals have of ADHD. The next one is parent training and support. So if we're seeing a child, or if you do have a child, as a parent, it's important to be a part of the treatment process. So you can get guidance from the therapist and learn strategies, what to implement at home and to support in the treatment process overall, and also in schools as well, so working with the school professionals so everyone can be on board, because it's a cohesive, collaborative type of approach when you are a young child, because that structure needs to be in every aspect of their day-to-day lives. So providing guidance and strategies to parents to help them support their child effectively. This can include setting clear expectations, maintaining the routines, and using positive reinforcement. And I mentioned collaboration with schools is number 9, working closely with educators and create an IEP, individualized education plan, ensuring that the client receives appropriate accommodations and support in the classroom. Number 10, lifestyle modifications, encouraging healthy eating habits such as regular exercise, a balanced diet, getting enough sleep. All these can significantly impact attention and overall well-being. So it's a mind, body, spirit approach, and everything around you needs to be aligned with the goals of reducing these symptoms as much as possible, especially if you are someone who would prefer not to be on medication. So hopefully this video was helpful to anyone. Feel free to like, comment, any questions you might have or any thoughts you might have in regards to this subject, and maybe any comments on what other topics you guys would like to hear in the future. All right, so thank you very much. Love and light. Until next time.